I'm Lise Fratello, the program director, and here with me is my program coordinator.
Hello, I'm Melissa Yeager. I am the program coordinator here at East Pierce Family Medicine. I have been here since the program opened in 2012, and I love being here, and I can't wait to get to know you better.
So I love this photo because this is taken from Tacoma, Washington, outside Point Defiance Park. You can see Mount Rainier in the distance. This is a mountain that we see from almost every angle. There's some great views from the hospital. Puyallup sits just in the valley of Mount Rainier, so we get to enjoy the mountain a lot. East Pierce is part of the University of Washington Family Medicine Network, so we call the group WWAMI, and that stands for Washington, Wyoming, Alaska, Montana, and Idaho. All the little red stars are the residencies in the area, and even since I got this slide, there have been more. So we are a network of programs, family medicine programs that works together to ensure that we have the best family medicine training in the nation. So we work together. Our program coordinators meet regularly to ensure that we're all doing best practices. Program directors meet regularly, and it's a really great network to share resources and, like I said, best practices and training for family medicine. East Pierce Family Medicine is located in Puyallup, Washington, so that's where that big purple star is. We are between Tacoma and the Mount Rainier Basin. This is a really cool spot of Washington. We are near Commencement Bay, so near the water, lots of islands. We are essentially between the national parks of the Olympic Mountains and Mount Rainier National Park, so there's a ton to do and explore in this area. We're very close to Tacoma, which is a very urban area. We're about 35 miles south of Seattle, really easy to get to. There is a great commuter train between Puyallup and Seattle. And then Puyallup itself is a growing area. We are considered a rural and suburban spot. We're really a safety net for the rural areas that are around Mount Rainier, and this allows us to have an incredibly diverse patient population. So we have probably 15 different languages at least spoken here. We've got patients who are unhoused. We've got teachers and billing workers. So it really makes for a very vibrant, interesting practice. East Pierce Family Medicine is part of MultiCare, and Good Samaritan Hospital is our main hospital that we work with. This is an institution that has supported graduate medical education for many, many years. Good Sam's a big hospital, incredibly busy. So we've got a busy hospital service, ER. We've got a busy labor deck. We've got access to laborists 24/7. We've got an ICU and a NICU. And then for a couple of years now, we've had a unit that helps stabilize women with chemical dependency. So this is a longer stay program, and it's been really successful in treating substance use during pregnancy. We've helped to stabilize women and take care of their babies. So this is a pretty special part of our program. Our clinic is just across the street, so it's super easy to take care of your patients in the hospital and then go to clinic afterwards. Good Sam's a really sweet hospital to work with. It's a community hospital. It's not for profit, so it's not a religious institution, so we don't have restrictions on things that we can prescribe or do. And it's been here for a long time.
So I see you say it's a nonprofit hospital. Does that mean it's PSLF eligible for my student loan forgiveness?
That's a great question. It actually is.
Thank you.
Yeah. And I've had graduates even be able to use the PSLF. So it's great.
Okay.
So there's a couple of things I need to tell you about rules and regulations. So first off, MultiCare does require flu vaccination. And then also we do tobacco and drug testing. And those things do start pretty much immediately after we find out that we matched with you. And this is a pretty fun picture. MultiCare had a really fun day. We had kind of a fair come to campus, and that included these sweet bunnies. So that's Melissa there with the sunglasses on, and then Becca Mahaffey is one of our other coordinators and fellowship coordinators that helps out with our residents as well.
And we got to play with bunnies.
So cute. So here at East Pierce, we really do consider ourselves a big family. We're essentially a small program. We have 6 residents per class. We have an addiction medicine fellowship. And this year we've got 2 addiction medicine fellows. And then there are 7 family medicine faculty, and we've even got OBGYN on staff as well, who works with our addiction medicine fellowship. So we're pretty strong with addiction medicine. I've got a palliative trained faculty provider, and another provider that started just this last year who trained up in Alaska and has been doing hospital medicine. So she's bringing us a lot of training in procedures and point of care ultrasound. We also have a clinical pharmacist on staff. She's a wealth of information, and she usually is present on our interview days, so good to meet her. We have a behavioral scientist who helps us with patient-centered care. We have a counselor right on staff, right on site, and then we've got a social worker here. So lots of great resources for our patients. Our nursing staff is incredibly supportive. They've been involved with training for our residents for many, many years, and just love that part of their job. And then the administrative staff. So, we couldn't run the residency without our coordinators, and they really keep us going and keep everything moving. Here at East Pierce, we have the vision of educating and empowering our family physicians as agents of change. So our hope is that when you graduate here, you're able to go out and practice the type of medicine that you want to practice. So we've designed our curriculum that really supports this along the way. So we look at things like adult learning, so kind of a progressive style of training. We want to make sure that you have adequate rest between your shifts. We've been able to create tracks. Sports medicine, addiction medicine, palliative medicine are areas that are pretty easy for us. And then when I have a resident who has a special interest in something that maybe one of my faculty isn't trained on, we're able to support that through resources in the community. We do train full spectrum family practice with OB, and our residents go on to do all sorts of things.
Can I ask one quick question? And you may get to it, but if not, the adequate rest. Can you tell me a little bit about what the day looks like our shifts versus call schedules?
Yeah. So we know that to learn, you need to be essentially rested. And so we've created shift work, really rather than, call. So when our residents do our family medicine rotation, they're working 6 days a week. They're 12-hour days, so they're long days, but they get to go home. So there's no 24-hour call for our residents. And then we also ensure that we get minimum 1 day off every week. And that's really helped our residents have balance and get a little break between coming back into the rotation.
And as a R1, am I going to be expected to spend overnights at the hospital? Am I going to do night shift as an R1?
So we don't have our R1s do night shifts. We wait until the middle of your second year. That way you really know the hospital very well. You know our patients, and you've done ICU rotation, and you've done inpatient for about 1.5 years. And so you're really ready to do night shift. And that's a great example of how we really progressively allow our residents to learn what they need to do to take care of patients.
Awesome, thank you.
Our mission is to create well-rounded, compassionate, resilient physicians who advocate for residents in their communities. So this is my intern class and my last year's graduating class. So people go on to do all kinds of things. So I feel like we're a program that has enough diversity in our training and skills with our faculty that we're really able to meet this mission. So what this really looks like is a progressive curriculum. We do 2-week blocks, which also allows for enough stamina to get through some of the tough rotations. We see the first year as a foundational year, and so here's where you'll get your adult, pediatric, and OB inpatient experience. We also have foundational things like your sports ortho, ER, NICU, community medicine, and surgery rotations. And then in your second year, it's more of a exploratory year. You get some leadership. So as a second year, you're essentially in charge of the medicine panel. Your experiences expand. You continue on with OB, but here's the year where you will have experience with addiction medicine, ICU, night shift, geriatrics, sports ortho, and then we've got lots of electives for you to spend time in the area with specialists or even with other family practice docs or urgent care. So you get to really kind of figure out what you might want to do when you graduate. And year 3 is more about leadership and teaching and some self-directed growth. So during this year, you're doing more teaching, really working one-on-one with med students. You've got more continuity OB than you do have the actual OB rotation. Got a little bit of night shift, and then specialty pediatrics, gyne, and then again, community medicine and lots of electives.
Can you tell us a little bit more about the peds in the first year, the Mary Bridge rotation?
Yeah, that's a great call out. Our pediatrics is done at Mary Bridge, which is in Tacoma, just about 25-30 minutes from Puyallup. And this rotation is one rotation that's actually 4 weeks. So our residents work with the pediatric inpatient providers and really get immersed in that rotation. And so it's a great learning experience. There's a total of 2 months during the year. The other thing to call out is our ICU rotation during the second year. So this rotation is done in Spokane, Washington, with internal medicine providers at Deaconess Hospital. And that's a new thing that we started this last year, and our residents have learned so much. I've actually really enjoyed the teaching during that rotation. And then things that kind of go on throughout your years that we consider longitudinal. So osteopathic medicine, continuity clinic, get OB throughout the 3 years, our psych procedures, and then the tracks all throughout the whole program.
Will you tell me a little bit more about the 2-week blocks?
Yeah, so we've done 2-week blocks now for maybe about 5 years, and it was something that we had been a 4-week block program, and we're looking at how to sustain learning and also keep our residents well. And so made the switch to 2-week blocks instead of 4-week blocks. And what this has allowed us to do is have a lot of flexibility within our curriculum and within resident schedules. So if you think about a month, then our residents typically get 2 weeks out of that month. They're doing a more intensive rotation, and the other 2 weeks are doing a slightly less intensive rotation. And so it means that, if you're on an intense rotation like inpatient, and you're not going to be working, you're going to be working some of those weekends for the next 2 weeks that follow, you're going to get both weekends off, which is huge. So you get time with your family and, time to have vacation, things like that.
Okay, one more question. The last one's about what other residencies are within Good Sam Hospital? Like, am I going to, is there OB residents? So then I may not get the cool OB stuff.
Mm-hmm. That's a great question. We are essentially unopposed. We do have some residents come from Madigan on our OB rotation, but they actually come at night when our residents are not present on the deck working with the laborists. So we've got a learning community in this region where we really share the learning opportunities. And so places where you might find other residents, especially the Madigan residents because they're close, would be in the ER and on OB, but we're able to share those shifts. And so our residents don't lose out on any learning experiences.
And are there other things do we work with TFM or Tribal Health or CHC on workshops
Oh, yeah.
Any of that kind of fun stuff.
Yeah.
Do I get to know my other resident classmates in the region?
Mm-hmm. Yeah, so this is a really cool location. So what Melissa's referring to is in Tacoma, there are three other residencies. So there's Tacoma Family Medicine, CHC residency in Tacoma, and the Tribal Health residency, PDHA. And we're able to work with them for our OB training. And so a couple times a year we work with them, and we either get together here on our site or at CHC and learn from their DO faculty. And even our MDs are invited to that so that everybody can learn. And then on our Mary Bridge rotation, Mary Bridge is one of the only pediatric hospitals in the region. There's us and the Seattle Children's. And so we all share the learning there and really work together. And that's actually been a fun part of working at the Mary Bridge site. Did I miss anything?
Have we talked about didactics at all?
No, we have not. So didactics are every Thursday, and our residents are protected to be able to attend those as much as possible. There's a whole lot of things that we do during didactics. So, one of the most favorite things is to do our procedure workshops. I've got one of my faculty who helps run those and make those really fun experiences. Those are about once a quarter. We have our osteopathic didactics, and again, everyone is invited to those, so our MDs can learn osteopathic medicine as well. It's a great time to be treated, in addition to learning techniques and updating techniques. And then we do, everything from guest lecturers to resident lecturers to your faculty doing presentations.
Awesome, thank you.
And I think that's about the end. So, photo from the San Juan Islands, just kind of highlighting our beautiful area. And I look forward to meeting you all and answering your questions. Thanks all.